And I'm just looking for the same respects other veterans get in this medical field. My name is Rayven Grier. I'm a United States Navy veteran. I'm a survivor of military sexual trauma, and I'm a proud and open trans veteran. So the VA has been slowly chipping away care for minority veterans under the guise of DEI cuts, and is slowly affecting veterans who are not just minorities. It's a stepping stone, unfortunately, to greater cuts. We've seen it first with trans veterans like myself, who, fortunate for me, I'm lucky enough to actually squeak by the cutoff and retain my care. But trans veterans after me are losing it, have no access to it with the VA. Doctors, unfortunately, must deadname their patients, misgender them in their documentations, and refer to them by names that are no longer relevant. I am worried about my care because with no rules of no new care at the VA, if my doctor who prescribes my HRT either leaves for a promotion or moves, I have to start the cycle all over again, and I will no longer get it. There was also a new rule published a month or so ago that VA doctors can no longer make letters or notes of support for trans veterans seeking care outside of the VA. So if I would go to Allies here in Pittsburgh, a place I've gone to in the past, with no insurance, I would not be able to get a recommendation to go into their office and receive their care. And it's not just trans veterans, it's the LGBT veteran community as a whole. We had this program called Pride in All Who Served, a program that let veterans know of what programs, what resources were there for LGBT veterans. But it was also a place to connect with LGBT veterans across many decades. I've talked to LGBT veterans from the Don't Ask, Don't Tell era. I've talked to some from World War II with the Lavender Panic Scare. And I've talked to some who served around the same time I did and after. And this is just the first set of chips. It is now getting into women's reproductive health. Any parent who needs an abortion, the rules are stricter again. Doug Collins and Donald Trump have rolled back the Biden-era reproductive rights of veterans. Before, it was if there was going to be a high chance of fatality either for the baby or the parents. Now, the risk is higher because now it has to be 100% fatal to either the baby or the parents. In cases like in Texas, we've seen this where if it's 100% fatality rate, the parent is already going into septic shock or sepsis because they can't do anything until it's actively killing the parents. Sharing a little of my story to wrap it up, I lost my therapist earlier this year. I'm lucky I took the time to research and find someone else to actually help me. The reason why it was a struggle for me is because my orientation when I served was a justification for the people who attacked me to do what they did. And that is intrinsically tied in to my PTSD. I'm not looking for any special treatment. I'm just looking for a doctor, a therapist, who understands the things that I have gone through, who can understand my struggle as an LGBT veteran. And I'm just looking for the same respects other veterans get in this medical field.